Hi, I'm Pam, and this is my second video on my journey through ovarian cancer and treatment. The last time I talked to you, I was getting ready for my first treatment, and now I'm getting ready for my fifth treatment of a total of 6. I will be getting 6 total treatments. So I wanted to tell you a little bit about how my chemotherapy's been going. The first chemo I got, I really didn't have any nausea or vomiting. What I experienced was flu-like symptoms. Very tired, extremely tired, like weak. You get up to go to the kitchen from the couch and you have to sit down because you get short of breath. I also am getting a Neulasta shot after every chemo. You can't have it for 24 hours, then you go in and get your shot, and what it does, it keeps your white blood cell count up. And you want to do that because you want to continue to get your treatments and not get put behind schedule. Or that's how I feel anyway. I want to get them and get them done. Now the Neulasta shot does cause bone pain, and I imagine it's because it goes into your bone marrow where your little cells are made, and that first shot I experienced quite severe bone pain. It was very uncomfortable, hard to get relief, but as it went on, now I'm not really experiencing anything. So it's like, I don't want to say a one-time. First time was the worst, second time was, okay, that wasn't so bad, and then I don't think I've really had any since, so that's good. Now, after 4 treatments, it seems to be lasting a little bit longer, the weakness, the fatigue. If I get my treatment on Wednesday, by Friday afternoon, evening, I'm starting to feel the effects. And maybe for about 5 days before I can come back to work and try and do something. So since I'm looking at my 5th treatment, I don't know what will happen, but I'm guessing maybe it might linger a day longer because I feel like it's building up, and that seems to be what it's doing. But I'm planning on coming back to work maybe a week from this Thursday, so I'm trying to leave time in there because you can't work when you feel like this. It's really hard. You're so weak, you just can't do it. You can't do it. But the good news is no nausea or vomiting. Now maybe once or twice I might have had a little nausea, but that's all. And I do get a nausea medication before they give me my chemo that day, so that does wonders, or they've improved on the drugs, I don't know which one. Another side effect I have, which is a side effect of chemotherapy, is neuropathy, and I'm getting that in my hands and my feet, mainly. I've noticed it more in my feet, but my hands are getting numb, my fingers are numb and tingly, and so are my feet, and it is uncomfortable, but they have changed one of my chemotherapy drugs last time I got it to help with that. I also take vitamin B6 to help with that every day, twice a day. So, you know, there are some side effects, but hopefully that'll go away, or at least most of it will go away. I don't know after my chemo is done. But now my next question is after chemo, and I haven't asked that yet. I assume I'll be followed every 3 months with CAT scans or something, but after my 6th treatment, when I go in for my 6th treatment, that's when I'll ask that question. And things are going well. When I feel good, but then I get knocked down again. I can't say I ever really get blue. The only time I'm sad or blue is when I'm feeling bad from the chemo. I have noticed that I get just blue. I don't know how else to say it, but as soon as I start feeling better, I perk right up. So I don't feel like I'm before my next chemo, that's as good as I'm going to feel, but it's not normal. I think I still have fatigue and stuff like that, but at least I'm able to work. So that's where I am right now, and so I guess you'll see me again after my 6th treatment.